Welcome to Health Sciences Update. I'm Doug Nadvornik. Today we're going to talk with two of Washington State University's Deans of Colleges of Health Sciences. A little bit later on, we'll talk with Patricia Butterfield from the College of Nursing. But in this first half, we're going to talk about medical education with Ken Roberts, who is the acting dean of the College of Medical Sciences. Welcome, Ken.
Thank you.
Washington State University's had a long history with the WWAMI Medical Education Program, the University of Washington's Medical Education Program. WWAMI stands for Washington, Wyoming, Alaska, Montana, and Idaho. For more than 40 years, WSU has worked with WWAMI medical education students, and in 2008, first-year medical students came to the Spokane campus for the first time, and then in 2013, second-year students came for the first time, and Ken Roberts, since 2000, has led the program. Tell us a little bit about WWAMI and how it's worked with WSU.
Well, WWAMI is a distributed medical education program for the University of Washington School of Medicine.
Distributed meaning?
Means that the students are educated throughout a 5-state region, or distributed means through a region. In our case, it's all 5 states that you just mentioned. The newest site for that program was Spokane, started in 2008 with first-year students. The program overall has been going for about 40 years with WSU's participation from the beginning with 20 students out in Pullman. But in 2008, WSU got a site for WWAMI in Spokane, which started a brand new thing here in the Spokane area, where of course we have a tremendous amount of our economy in the hospitals and the clinics and so forth. WWAMI is normally a distributed program where first-year students do their education out in the region, which we call anything outside of Seattle. They typically go to Seattle for their second year, so all the students converge. And then the third and fourth year, they're distributed again for their third and fourth year clerkships.
So why did WSU decide to consider its own College of Medicine?
Well, I personally think it's sort of a natural progression for WSU, having been involved with medical education for 43 years, so a lot of experience. Now that we've moved and have a presence in Spokane, where there are more physicians, more doctors, there's even more momentum in this direction. And then I think with the investments on the Spokane campus, bringing the College of Nursing down here a few years ago, bringing the College of Pharmacy last year, creating a college from the faculty who are teaching medical students through the WWAMI program, all has contributed to a critical mass in a moment when WSU is really ready to have their own medical school.
So how did WSU decide that it was a medical school was the way to go? You did a study. Tell us about that study.
Well, we've been having a conversation internally about this for some time. Washington has a really relatively severe maldistribution problem of physicians, so we have a workforce problem in the first place. We also have a capacity problem. We don't educate that many medical students in the state of Washington for our size, 7 million people. We have 120 spots through the University of Washington's program. So we need more doctors and we need more capacity to educate those doctors. The way most states get capacity is by starting additional schools, because medical school classes only get so big. And so it all seemed to be aligning to consider a medical school for WSU. And so with that in mind, President Floyd commissioned a study through MGT of America, a consulting firm who's done these sorts of studies before in other states, to ask some questions about medical education. Number one, what is our physician workforce situation? I mean, really nail it down. What is our capacity for educating physicians? And then what's the readiness of WSU to pursue a medical school if we decide to do that? And the first 2 points came back as we expected. We need more doctors and we need more capacity for educating students. But the third one was very encouraging. WSU, with its current investments, is in a great position to start a medical school with all the infrastructure we now have on the Spokane campus, the relationships we've made over the years through medical education, and all that wrapped together, I think, puts us about halfway into the accreditation process before we even begin.
So how would you, for folks who don't know about medical schools, how would you explain the differences between a UW medical school and what a WSU medical school would be?
Well, we're proposing at WSU a community-based program. By a community-based model at WSU, we mean that we would not build our own hospital. We would not create our own practice plan or our own group of physicians. We would not establish a series of clinics for referrals to our own physician practice plan. Basically, we would not create a care structure inside of the university. We would leave that to our established clinical partners, places in town like Sacred Heart Hospital, Deaconess, and so forth. A more traditional medical school, and most of these were started 50, 60 or more years ago, have their own hospital, have their own physician practice plan like UW-Medicine and so forth. So that's a fundamental difference between the two. Community-based models are, as a consequence, less expensive to start because you're not building all that infrastructure. And they're also a little less impactful in a negative sense, if you will, in a community because they don't rise up and compete with healthcare operations that are already there. They partner instead. There's other aspects to it which are very important. The community-based model does educate students entirely in the community setting for their third and fourth year. And you can do this in other locations around the state, as other states have done, like Florida State was mentioned in our study. Has 6 sites around their state. We would do something similar, so our students would have a chance to go out and get familiar with clinical settings in other cities, places where we have not enough doctors perhaps, build relationships, and perhaps come back at a higher frequency to those places after they finish their training.
So you've been out working really hard, getting to different parts of the state to explain this. What's the reception been so far?
The reception's been amazingly positive. And I just say that because you don't know until you go out and talk to people. And so we've been all over the state, and we have some more places to go. But everywhere we've gone, people are very intrigued by the model we're proposing. There's uniform agreement with our predicament as a state in terms of physician numbers, particularly out of our main metro area and the King County area. It's hard to recruit physicians, and we don't educate enough of our own. So there's a fairly sort of natural warm reception to the idea that we should have more capacity, that we should have another school. And in some places, a very, very overt excitement about perhaps partnering with us in this endeavor.
So you mentioned cost. Can you give us an idea how much it would cost to get a WSU medical school going?
Yes. So community-based models have been started around the country in the last 15 to 30 years. And so we have pretty good estimates on what they cost to operate once fully up to their maximum size. And we also, through MGT's study, have a pretty good understanding of what it costs to ramp up to that size. So for us beginning a medical school now, going to the state legislature this term to ask for some startup funds and support for this endeavor, which will be important for our accrediting body, we're going to ask for about $2.5 million, which is enough money to get us through the accreditation process and hire a founding physician dean. And then after that, the price scales up with the number of students. So we'll start with 40, and over a decade or so, we plan to grow to 120 students per class. That's not the ceiling, really, but that's our target. And we could grow larger than that over time.
You mentioned the accrediting body. Can you tell us a little bit about what that is all about?
The accrediting body, the LCME, is the Liaison Committee for Medical Education. Like all professional schools, it's the body that oversees the accreditation process, saying whether or not you're producing the right kind of graduates. It's a very rigorous process. It's a very involved process. It begins with basically a declaration to them, an application, if you will, for starting the process, and then they come and visit you, give you some advice, you put together a curriculum, you submit unknown numbers of documents and supporting things to the LCME, and then they come back again and site visit you to tell you whether or not you're ready to actually admit that first class. And this usually takes about 18 months or so.
Your college moved into a new building in last December of 2013. Would you need new facilities if there was a WSU medical school?
We do not need new facilities to begin. So we don't need to ask for anything new as we approach the starting of this medical school. So we have all the teaching facilities that we need.
You have a growing research presence on this campus as well. How does that fit into a medical school?
Well, the LCME does require that medical students are educated in an academic environment that includes research, faculty involved in that endeavor. So a research faculty is expected. And we are building out our faculty on that model. The new PBS building that we were just talking about, in addition to the specialized teaching facilities that we need, also has several tens of thousands of square feet of basic research space. So we have a very rich and growing research environment for our students to be educated in.
How do those faculty do a lot of teaching, or do you bring in clinical folks to do the teaching?
It's a combination. And actually, even on the research side, it's a combination. So clinical research is also important. So physicians doing research with patients, more outcomes-based, is also part of that research mix, and there's a lot of that going on at the hospitals in town as well. So with the students, with the faculty, they do in fact teach. But in a medical school, and really in a lot of professional schools, the faculty spend oftentimes a majority of their time doing their research. But they still have student contact, and educating the medical students is still an important part of what they do.
Do you see anything new in terms of approach with a WSU medical school? Is it much different than a traditional model, or are there new things that you're looking at?
Well, there are new things that we're looking at. So you only get to start once. And when you start is the best time to put in place new and innovative things that you would like in your curriculum. Because once the curriculum is underway, it gets harder to change it than it does to start it. So we're looking forward to that process. Obviously, we're thinking about what's coming for physicians as they practice. If we started a medical school right now, which we can, we have at least 2 or 3 years off, it would take 7 years for us to produce a practicing physician at a minimum, given 4 years of medical school and 3 years minimum of residency. So we're really contemplating physicians of a decade from now. And so we think about what will the practice environment be like then? What will the ACA become? What will the emphasis be? What will be the payer models and so forth? So we can't predict that perfectly, but we're talking to people who think about these things and project these sort of things so that we have a curriculum that's ready to produce physicians that will be appropriately trained for that time. Of course, you have to do all the normal things. They have to know about the body and how it works and so forth. So there's a lot of things in the curriculum that don't change. But there are some things we think that will be changing, and we're excited to put some of those in the curriculum.
So WSU has been talking about the need for rural physicians, especially in eastern and central Washington. How do you do a job of creating more physicians who would go out into those rural areas?
That's a very important question, and it's a difficult one to answer precisely because you just have to do your best to produce those sorts of physicians, and it's an imperfect process. But amongst the things that we will do, because others have done them with good success, is use our admissions process first and foremost to create a candidate pool of the types of students that you think will become those sorts of physicians that will go back to the places where they're really needed. And then we will set up our community-based distributed medical education systems so that those students have a chance to practice in, or at least close to, areas where they're needed the most. There's something about educating medical students where you want them to be. It has an influence on where they practice in the end. So we will use that in the process. Again, you can't get them all there, but you won't get as many there unless you really try deliberately to produce physicians for that type of location.
Okay. Ken, thanks.
You're welcome.
We've been talking with Ken Roberts, who is the acting dean for the Washington State University College of Medical Sciences. Coming up, we'll talk with Patricia Butterfield from the WSU College of Nursing. This is Health Sciences Update.
Welcome to Health Sciences Update. I'm Taryn Roloff, and I'm here with the Dean of the College of Nursing, Patricia Butterfield. Welcome, Patricia.
Thank you, Taryn. It's a pleasure to be here.
Well, you know, the College of Nursing is one of the oldest colleges on campus. There are 3 headquartered here. So tell us a little bit about the history of the College of Nursing.
Our College of Nursing has a remarkable and very unique history nationwide. Here's what happened. In the 60s, in this region, nurses were educated with a technical degree and received an associate degree from some exceptional hospital and college-based programs in the area. To bring on nurses having a bachelor's degree or a master's degree, a group of very visionary women came together, and over a period of several years in the late 60s and the early 70s, they all voted to shut down their own individual programs of nursing. This was stunning. This was unparalleled in the United States. This was a very, very courageous and selfless act, and it was done for one reason. It was done to elevate nursing education in Eastern Washington and throughout the Pacific Northwest. It doesn't mean that what we were doing wasn't already good. These were very, very strong programs, but the standard for nursing education was a bachelor's degree, and these visionaries knew that we needed to get there. So they created something called the Center, and it had different names, ICNE, ICN, the Center for Nursing Education, And the center needed an institutional home, and it made sense that Washington State University would be that home. So one day, several of the leaders drove to Pullman to meet with President Terrell. And the way that they tell the story, and several ladies in their 90s have told me this story, and they tell it exactly the same way, is that they drove to Pullman, and when they got to Colfax, they went and they saw a church up on the hill, and they went in and they said a prayer, hoping that the university would take ownership of the center. They went down to Pullman, and the president said, "That sounds like a great idea." They were so excited, and when they came home, they stopped in Colfax again, and they went and had a drink.
That's a great story.
It is a great story, and it's a true story, and it fits with who nursing is in this region. So they came back, and the center, ICNE, ICN, and Washington State University College of Nursing have educated remarkable nurses that serve all over the world. We have nurses that are in military service all over the world, East Coast, West Coast, international work, and it's all because of this courage and very, very unique entrepreneurial spirit. I'm very proud to be a part of it.
Because the various organizations that sponsored them were area colleges.
That's correct.
Correct.
That's correct.
So it was really nice that they were all able to agree that.
It is amazing. Right before my generation, many nurses lived in a nurse's dormitory that would be adjacent to the hospital, and they would be called in to do their work, and then they would stay right at the hospital in a dorm. In fact, if you look at hospitals, you'll always see those buildings nearby. But to move us into university education took this giant leap of faith, and there are many ways that this happened throughout the United States, but in Spokane, Washington, and at Washington State University, this happened in a very special way.
Very good. So in addition to that change and being a leader, actually beginning the whole collaboration conversation that we still have on this campus with Eastern located here, and the community colleges, offices nearby, Whitworth
Right.
program as well. But it was unique, it was very unique, obviously, but now it's grown tremendously. Let's talk a little bit about how it's changed in that growth.
Our numbers have grown, and right now, statewide, depending on the semester, we're between 900 and 1,000 students. And it depends whether you count them in terms of full-time or what we call head count in terms of, so there's a couple of different ways in counting. These students receive a bachelor's degree in nursing, or they have an associate degree and they're coming here for a bachelor's. They receive a master's or clinical doctorate, and then we have a small group that receives a PhD.
Wow. Lots of options.
Lots of options and lots of ways to serve. That's what makes it so powerful. So our bachelor's nurses get out and maybe they work in a psychiatric facility out at Eastern State Hospital. Maybe they work at one of the amazing hospitals or clinics. Maybe they work in public health or one of the community services, and they provide bachelor's level nursing care. A lot of our master's and DNP graduates are nurse practitioners. They become a family or psychiatric nurse practitioner, and they have full prescriptive privileges in Washington. So you can see them for common health problems. They're wonderful providers. They have 3 years of education, post-bachelor's degree, and they are serving Washington. I think there's something like 16% of primary care visits are to a nurse practitioner. It's really we're such a central part of the healthcare workforce, especially in healthcare reform, because if you look at what people need and how they get those services, nurse practitioners are a linchpin in working with medicine, in working with physician's assistants. But without it, many of our rural areas, especially western Montana, Idaho Panhandle, eastern Washington, they would be without primary care services. And so I'm just so pleased we're able to do that.
Now we also have students, and I don't know if they're included in your count, I don't believe they are, in other locations, in our other urban campuses in Tri-Cities, in Vancouver. Talk just a little bit about that.
You bet. At Washington State University, I talked a little bit about our history in terms of how we came to be in this unique way. how we are now in a unique way compared with many other colleges of nursing, many other top colleges throughout the nation, is that we are located in a couple of different places, but we function as one college. And how we do that is that we're leaders. We were early adopters in distance delivery, early on, 25 years ago. So when we were in Spokane, first we added a cohort of students in Yakima to address the workforce needs for bachelor's and graduate education in Yakima. And then we added a campus in Vancouver, and that's been a very, very strong campus that reaches into Southwest Washington and really is just so well respected and serves the I-5 corridor down into Oregon, many of the border counties. It's really remarkable. And now we have a group of students and a wonderful group of faculty in Richland at WSU Tri-Cities. We have some really magical things that are happening there in terms of nurse practitioner education. We have some very unique and special arrangements with hospitals and clinics in that area. And many of our community partners have stepped up in really an unparalleled way to support the College of Nursing, what we need to do to add faculty positions, because they recognize that if you look at economic well-being, a critically educated and deep nursing workforce cannot happen. No community can be economically sustainable without that. If you look at any place where nurses have to be imported, it's overly expensive. There are challenges with quality, and the community does not have a core. And so there's both a workforce need that makes it critical to economic development, as well as a quality access, and people want to see a nurse or a nurse practitioner that lives in their community, that understands what's happening in terms of this year's flu, or what's happening in terms of meningitis, or what's happening in terms of needs, in terms of students that need school lunch, or how to address needs in terms of reaching out for adverse childhood events, or really being very proactive to prevent and reduce things like domestic violence or substance abuse in the community. That's what a strong nursing workforce does.
All right, you've touched a little bit about some of the uniqueness of the program. The College of Nursing also has some special emphasis here in Spokane, at least. I know your sustainability program.
Right.
Want to talk a little bit about that and any other unique programs?
Thanks for asking about that. We do a couple of things that are different and really magical, and I'll anchor this a little bit around doctoral education. So if we look at programs that create a nurse scientist, somebody that knows how to design a study about how to make care as good as possible, those are nurse scientists with PhDs. So here we are in Spokane. If you look at, there's a program in Seattle, there's a program in Portland, there's a program in Salt Lake, there's a program in Denver, and there's a program in Minneapolis. In 2007, we became the program in between all of that. So if you want to get a PhD in nursing so that you know how to do the statistics as well as conduct the study or the anthropologic work to determine how to make a difference in healthcare between best types of asthma care or what we can do in terms of healthcare transitions when people are dismissed from the hospital, this is the place to come and get your PhD. It's amazing. One of the things that we do unique here, and we're nationally known for this, is that we educate nurses and we conduct a lot of research about how to make healthcare environmentally responsible. Every day that someone is in the hospital, about 33 pounds of medical waste is generated. It's huge. Healthcare is about 10% of our nation's carbon footprint. It gobbles energy, it uses resources, it creates a very complicated waste stream where pharmaceuticals end up in our water, in the Spokane River. Are these at high levels? No. Do they have scientific consequences? We don't know. But what we want to do as nurses is we want to be key stewards in terms of responsible practices. Because healthcare uses so much energy and has such a complex waste stream involving chemotherapy, low-level radiation, paper waste, metal waste, a variety of types of things. If you really want to change that, who do you look at? You look at nurses, because they're everywhere in the healthcare system. They're at the point of care, so they can make a decision about how to provide safe care, responsible care, keeping the patient safe, but making sure that your children and your grandchildren, who are going to be working in a very different world, have a world where healthcare is sustainable. The nurses that we educate are undergrads, and if I walk into our building right now, the undergrads that are there graduating in 2014 will be practicing 35 years from now. When I was born, the world had about 2 billion people in it. These students will be practicing when the world has 9.5 billion people in the world. It's a 4-time increase in population. So if we're going to do things and we're going to have a world worth living in for our children and grandchildren, everybody's got to step up and look at reducing waste in different ways, and our nurses are leading the charge.
All right, we only have a couple minutes left, so I want to ask you about research briefly, and then come back to you personally, because you're leaving us here pretty soon. We want to talk a little bit about that.
Okay. In terms of research, we have 4 areas that we work in that we consider signature areas. One is what we call the science of how we educate clinicians. So we're interested in if we educate somebody using simulation versus a book, does that make a difference? So we conduct science in that area. We also conduct research around mental health and substance abuse. When we look at how people pivot in healthcare very quickly between home health, hospital, long-term care, that's where errors occur. And we have a group of scientists that really focus on how to reduce errors there, so that when your parent or your sibling or your child is dismissed from the hospital, they know what medication to take and they know what to do.
All right. Now I know that the vast majority, well, the majority of BSN students have graduated from this program,
Right.
College of Nursing through WSU. So that in itself is a major accomplishment. But talk just a little bit about your legacy, because you are retiring in April, I believe. And
so I will be retiring from the dean's position. I'll be staying in a faculty position. I came in 2007, and last year, statewide, we went for a whole accreditation for all of our programs. Came through with flying colors due to incredible work for our faculty. And now we're in great shape. We have a great leadership team. And I thought I'd like to spend the next few years being a faculty, doing environmental health, doing worksite health, the type of work that I love. So I'm not retiring, but I am stepping down. I'm going back into a faculty position. What I'm proud of is the work that this faculty and staff has done. The same reason I came here in 2007 was that the person at the reception desk looked the student in the eye and said, "What can I do for you? What do you want to be? How do you want to improve healthcare?" To make students that are both centered, practical, and intellectually curious to change healthcare for the next 40 years. That's what Washington State University College of Nursing does well. I think we do it better than anybody. I'm very proud of what we do, and we do it because this college knows where its soul is, but it's still eager to change and be contemporary. And it's that combination that is remarkable. I've been very, very fortunate to lead that effort.
all right. Well, thank you very much, and
Thanks.
really excited that you'll stay here with us at WSU Spokane.
Thanks a lot. Thanks, Tara. Take care.
And thank you for joining us on this edition of Health Sciences Update.